Let the last folks join us. If you've been with us before, welcome back. And if you haven't, well, welcome. We're very pleased that you're with us today. Okay, we'll get started here, folks. My name's Wayne Elliott. I'm the president of the Strauss Naturals Company. I started a customer just shy of 30 years ago after a heart attack 36 years ago, 37 years ago at age 35. So I started out a customer and then ended up, of course, Jim Strauss and Peter Strauss, very close friends. As Peter is today, Jim's no longer with us, rest in peace. Peter still helps us. My family now own the Strauss Company and very passionate about this. And basically, I want everyone to have what I got. And that was a return to good health. It's now, since that heart attack, it's 37 years. My heart is strong. I wouldn't be here, I'm just sure of it, because I never took any medications. I never had an open heart surgery. I refused all of that way back then. And I'm glad I did. And to this day, I've not had 30 years, no pharmaceutical, no over-the-counter drugs, nothing but Strauss. And of course, I do take vitamins and minerals and curcumin turmeric for inflammation, and I take a bunch of other stuff. Strauss doesn't make vitamins and minerals. We make serious natural medicine, truthfully. And we're going to talk about our formulas today. But just to start out, just some information. And you please forgive me for doing some reading with this today. I don't want to miss much. We're gonna focus on our urinary products as well in greater depth today. The men's prostate and the bladder formulas for everybody. They're fabulous. There are two fastest working products, our two fastest working formulas with respect to reducing or eliminating your symptoms. So I'm going to get into those in a few minutes. But to start out, Strauss Naturals herbal formulas do not contraindicate with any pharmaceuticals. They're as different as food and man-made chemical drugs. The difference couldn't be further apart. So it's very important to know, because so many people are on pharmaceuticals, that there's no trouble, there's no contraindications with your pharmaceuticals. I'm not promoting pharmaceuticals, of course, but I understand that so many people are on them, but you don't need to have the fear of contraindications. I do urge folks to read the paperwork from their pharmaceutical formulas, and most particularly the potential serious side effects and harmful effects. If you don't do that and you don't know what they are and end up suffering one or more of them, you could get yourself into trouble. So please do read your paperwork on your pharmaceuticals. And then if you are suffering a side effect, you can speak to your doctor and he or she can change the drug or change your dosage or whatever they decide to recommend to you. But if you don't know, then, you can't do anything about it. So it's very important. In 46 years, there have been no complaints to the US FDA, to Health Canada, or to the Strauss Company of serious or harmful side effects. Not one in 46 years. So these are proven safe. There's 100% satisfaction guarantee. That's very important. You can't be duped or cheated for your money. And we sure don't get many returns, that's for sure. Our products work. They work well. You don't have to take them for life because they do work. The pharmaceuticals, of course, deal with our symptoms and do not deal with the source of the problem. Otherwise, if they worked, we would get to stop taking them at some point. Mrs. Smith, your blood pressure is better. You can quit taking the blood pressure drugs. Well, I've not heard of that happening in 30 years. I've heard formulas adjusted, dosages adjusted, and so forth, but I've never heard anyone that's heard that from their doctor. So 100% satisfaction guarantee, you will not get that with any pharmaceuticals, that's for sure. Most of our formulas are recommended to be taken a minimum 3 months. If you have an issue, a problem, you may have to take them for 6 months. The Strauss Heart Drops, our flagship product to make blood flow everywhere. We have a vessel, vein, artery, right down to the tiny capillaries to our skin. It is the most important body function, is blood flow. Hence, us having 50,000 kilometers of blood vessels inside each of us, twice around the earth. It's almost impossible to believe, but it's true. So blood flow, circulation, is our most important body function, and that's what the Strauss Heart Drops are for. And we recommend with the Strauss Heart Drops to take them for 1 year, do the job completely. And many people like myself, I've been taking them now, it's almost 30 years, and I'll never stop because I never want to go back to where I was with the clogged arteries or another heart attack. So the Heart Drops we recommend for 12 to 18 months. Many people stay on what they've called a maintenance dose, which is a great idea. I just stay on them because I don't want to return to where I was with the angina, the high blood pressure, the irregular heartbeat. I was going downhill in those 5.5 years between the heart attack and when I found Strauss, or they found me. Every herb in the Strauss Naturals formulas has long historical use. They're historically proven for centuries, many of them, insofar as the benefits and what we should expect from those. And Strauss has just masterfully put together. See, one herb cannot heal or fix anything. It can deal with symptoms. For example, if I have a headache or pain, I take white willow bark. That's what's in aspirin for the pain. Why they've added the chemicals that can hurt your stomach, I don't know. I just use the white willow bark. But it doesn't do anything about why I got the headache, for example. It just helps greatly with the headache or the pain. It takes 2 or more herbs to heal or fix anything. And of course, the Strauss formulas, many of them have up to 20 herbal ingredients, and we guarantee that they will work for you. There are many things that we should do in the interest of our own health. One of the major ones that I like to mention is drinking enough good water. I think that the great majority of us, myself included, many days, aren't drinking enough water. Our body is 62% water. Our lungs are over 80% water. And we do need enough. We even need it to make mucus to keep our sinuses clear, and need it for our urinary tract, our kidneys, and our bladder and prostate. It's very important to drink enough water. I start every day, and so should you, with a large tumbler, 12 or 16 ounces of room temperature or warm water. I squeeze a lemon in mine. I also put the granular vitamin C in mine. I don't know if you take vitamin C, you probably should. And I find that the easiest way and the best way to take it. So you start out before coffee, before anything, with that large glass of water or 2. It's just a great way to start the day. If you're constipated, look to the dehydration first. That if you increase water, and especially if you use lemon, which gives your liver a little bit of a knock, that is the best way to aid in that constipation. Death starts in the colon, as Jim Strauss would say, so it's very important we don't stay constipated. With the Strauss Heart Drops, it is so good for so many things. The bottom line is, of course, making blood flow everywhere we have a vessel to carry it, and getting rid of some of the cholesterol, plaque from cholesterol buildup, or the stringy fats in our carotid arteries. It isn't plaque there, it's these stringy fats. And that's what the heart drops are for. Diabetics are really the only people that should never stop taking Strauss heart drops. Circulation is their most serious issue. They can lose parts of themselves, toes, feet, legs, eyesight. And so that circulation is just so crucial. We recommend they don't have to take extra, diabetics, but we recommend that they stay on the Strauss heart drops. I could tell stories till the cows come home about diabetics that have been helped so greatly with the Strauss heart drops. So diabetics, anyone suffering angina, anyone that's had a bypass surgery or stents, clogged arteries, enlarged heart, congestive heart failure, and hypertension, high blood pressure. In the case of high blood pressure, it is either our heart, our kidneys, or one of our kidneys that's the culprit. It's only two sources, kidneys and heart. So if a person takes the Strauss heart drops and the Strauss kidney formula, we guarantee your blood pressure will normalize, or you get your money refunded. So that's just the first comments I wanted to make. We're featuring this month a sale on our bladder and our prostate formulas. They're just so important. I talk to many, many people, of course, as do all our good folks at Strauss. And it's amazing how many people, and I had it myself, issues getting up too many times through the night. My poor mother, before she took the bladder formula, she couldn't get back to sleep after getting up. So she would have 4 or 5 times through the night. And her biggest problem was exhaustion. And when she took both the kidney, actually, because she had blood pressure issues, the heart drops, the kidney, and the bladder formula, she would get up like me, maximum of once through the night, and she could get proper rest again. With males, it's funny how human nature seems to make us believe when we're healthy that it will happen to the other person, that we won't have the heart attack or we won't have serious prostate issues. The facts are that 1 out of 2 males, 1 out of 2 men will have serious prostate issues beyond age 60. My father, who I didn't know was on the pills, some kind of pharmaceuticals for his prostate for 2 years, until he told me he had to go back to Boston and have a prostatectomy, have it removed. And because our Strauss heart drops cleared his arteries and Boston Medical canceled his bypass surgery, he'd had an angioplasty, the balloon treatment to try and increase blood flow temporarily. And they wanted him to have open heart surgery. I convinced him to take the heart drops for 3 months. He returned to Boston. They tested and they canceled his surgery. So when it happened with his prostate, I was able to convince him of the same thing, take the Strauss prostate formula for 3 months, pardon me, and then return to Boston. They'll test you, Dad, and they'll tell you what they think. Well, he did that. My dad never had his prostate removed. He lived another 12 or 13 years and died with a healthy prostate. He never had his removed. I started to show some issues myself of a weak prostate, weak flow, sometimes urgency. Too many times through the night, I would get up. I do drink quite a bit of fluids at night, tea and water and so forth. And our prostate formula has my flow strong. I'm able to empty my bladder properly. So it's quite serious to let the prostate get to a point where, they're talking about removing a man's prostate. So it doesn't just happen to the other guy. It's funny how human nature, how we think it won't be us. So these two formulas, as I said, the bladder, which men or women, of course, can take, and the prostate for men. If you looked at the ingredients, you'll think these are identical formulas because they have the same 10 herbs in them. Where the big difference is the quantities, the proportion of each herb. And when you look at that and compare the formulas, you see how truly different they are because of that. Jim Strauss always said, you need the right, he'd say it's just like your mother or your grandma making a nice soup. You need the right ingredients in perfect proportion. If you use too much salt in the soup, it wouldn't be tasty, so you could eat it. Well, it's the same with these herbal formulas. You need the right ingredients, the right herbs in perfect proportion. So that's the considerable difference between our bladder and prostate formula.
You want to come in?
I don't know who that was that spoke up there. But there are differences in the quantities of each herb. That's the great difference between the prostate and the bladder formulas. Some men should take both. But just I wanted you to understand those differences. They are not identical. They have identical herbs, but with much different proportions of each. And within 7 days, I don't know of anyone personally that took longer than 7 days to notice a difference, notice reduction in those symptoms they were suffering, the urgency, leaking, incontinence, getting up through the night too many times. Within 7 days, you will notice some difference. Boy, I don't know why I'm dry throat today, folks. So in that respect, there are two fastest working products, formulas, in terms of helping you with the symptoms. Now, here's the other side of the coin. I'm always afraid that people will take these formulas for a week or two and then think they're better and stop taking them. Please don't do that. Do the job completely. Bacteria grows back more quickly in our bladder, prostate for men, and kidneys than any other part of our body, any other parts of our body. It grows back quickly. These parts of our body are stubborn to accept help, whether it's pharmaceutical medications or natural. I don't know why that is. I understand being a urinary tract and the moisture, how we're susceptible to bacteria. In each of the formulas is the nature's strongest antibiotic herb, golden seal root. That is the strongest antibiotic herb in nature. And each of these formulas, the bladder, the kidney, and prostate, have that as an ingredient, one of the herbal ingredients. And I've come to believe that bacteria anywhere in our body can really be the source of a lot of more serious problems. The other thing to really watch in our diets is that we don't get too much acidic food. For example, shellfish, lobsters, crabs, shrimps. That's not only the most acidic that we eat, it's the highest in cholesterol. So shellfish are truly not good for us. Things like coffee, some of the citrus fruits, grapefruit, for example. And you can Google acid ash foods and alkaline ash foods and see just for your own knowledge, and then you can have some kind of conscience about it. If, for example, if someone has gout, very, very painful gout, it's acid. That's the cause. So the best fix is lemons. If you or your husband or your friend, your mom has gout, it can be in the feet, it can be in the hands, and it is very, very painful. The best medicine is lemons. As soon as we ingest the juice of a lemon, our body, it's almost like magic, turns that lemon acid into alkaline. And so it's one of the best ways to try and keep your body pH not so acidic. In Ontario, it used to be on all the blood tests. If you had your blood tested, they would give you what they said was the healthy range of pH. And in actual fact, it wasn't. It was from too acidic to maybe not alkaline enough. And but they've stopped doing that. That's no longer on the blood test reports in Ontario. And I think it served to confuse the Western medical business. And so it is important, body pH. Cancer, for example, needs acid to grow and develop. If you had an alkaline body pH, theoretically, you could not get cancer, because it would be like trying to grow tomatoes in your cement or asphalt driveway. It needs acid. So, and yet so many of our foods, and of course, all refined sugars, everything, every baked good, bread, white bread is so bad that bugs won't even eat it. But any baked good, all the different types of sugar, the candies, and listen, I love that stuff personally. I get it. It's very tasty, but it's very not good for us. Our body cannot handle the refined sugars, and hence diabetes in some countries that have developed the Western medicine, have developed the Western civilization diet of drive-through fast food. If you look at Saudi Arabia, they went from no diabetes to half the adult population has diabetes. They love our fast food that we have started here in America. So something to be conscious of is the body pH, and not drinking and eating only acidic foods. And refined sugars are never going to be good for us. There is no case where refined sugar, the sugar from fruits, different story altogether, completely different story. But this refined sugar, as they call it, is certainly a nemesis to our health. Now, to get a little bit more into the bladder, prostate, our urinary tract, some of the herbs, for example, in the formulas are, and remember, they both have the same 10 herbs, just in different proportions, but blueberry leaf, juniper berry, saw palmetto berry, birch leaf, corn silk, linden flower, nettle leaf, white willow bark, that's nature's pain reliever, golden seal root, that's nature's strongest antibiotic herb, and uva ursi leaf. And just to review a few of them and what they purport to do. Blueberry leaf acts as a urinary tract antiseptic, a diuretic, and an antioxidant. It inhibits the growth of bacteria. Juniper berry, helpful in the treatment of prostate disorders, bladder infection, fluid retention, gout, obesity, and asthma. It also alleviates urinary tract problems such as gallstones and urine retention. Saw palmetto berry acts directly on the enlarged prostate to reduce inflammation, pain, throbbing, and swelling. It has been called the plant catheter because of its tonic effect on the neck of the bladder and on the prostate. Studies indicate saw palmetto berry is about 90% effective treating an enlarged prostate or benign prostatic hypertrophy, BPH as it's called. It's even more effective when used in synergistic blends with other herbs, like the formula I'm describing. Golden seal root fights infection and inflammation, cleanses the body, good for disorders affecting the bladder, prostate, stomach, or vagina, also heals mucous membranes throughout the body. So these are just some of the 10 herbs in the formula. Each of these herbs now has the historical, for centuries, proof of what it does and what it does to help us. So these are not, Strauss didn't invent that part. This has been known. The Strauss family have been master herbalists for 200 years, but some of these have been known much longer in some of the civilizations that have been here 1,000 years, for example. It's important as well with the bladder, the prostate, and the kidney formulas. Do your best not to skip a dose. For the reasons that I just finished saying, how bacteria grows back quickly, stubborn to accept help in these parts of our body. So do your best to not skip a dose. Even missing a dose or two, it allows any bacteria in the system to grow back quickly. What else here? Now, everything in our experience works better with the Strauss heart drops. And it makes good sense because heart drops make blood flow everywhere we have a vessel or any size of vessel. So it helps get the medicine, the food, whatever we're taking, to where it's needed and where it's going. So weak urine flow, incomplete voiding of your bladder, frequent daytime, nighttime urination. These are all issues that you should expect resolved from these formulas. Excuse me. And each of the, I can go into more detail. I will just on a couple of them. The saw palmetto fruit, overall genitourinary health in males, BHP, benign prostatic hyperplasia, chronic non-bacterial prostatitis, prevent hair loss, incontinence, and difficulty urinating. In both sexes, chronic pelvic pain, bladder disorders, and decreased sex drive. Can also be indicated in women with PCOS, with hirsutism to balance hormones. Saw palmetto contains fatty acids, collectively called liposterols, shown to inhibit the enzyme responsible for converting testosterone to DHT, lowers androgens such as testosterone and DHT to a balanced level. Nettle leaf, traditionally used for systemic inflammations, such as in allergic reactions. Source of vitamins A, C, and K, potassium, phosphorus, and calcium. It's antiviral, improves total antioxidant capacity and SOD levels, and is shown to reduce C-reactive protein. Anti-inflammatory effects on lower urinary tract and prostate. So these are all what these herbs have been traditionally shown to do. The Strauss genius in putting the herbs together into their formulas, there is truly nothing like the Strauss Naturals formulas in this world. There isn't anything like them. There have been lots of copycats. There have now been, I believe it's 36 attempts at copying the Strauss formulas, and no one has successfully done it to date. The bladder, again, it's the same herbs as in the prostate, just very different proportions, which I found quite interesting. So we don't need to go through those again. You can certainly ask questions. I've put my email address there if you have any questions, concerns. If you'd like a discussion, we can certainly have a telephone call. This is what I do. And our wonderful people at Strauss out in British Columbia. I'm here in Ontario, but our ladies and gentlemen at Strauss are just top notch. And we want everyone to be well. It's just as simple as that. I'm so grateful for my return to health after that heart attack and clogged arteries that, I want everyone to have that. Someone has raised a hand. I'm not sure what that means. Hello? Anyway, hello, Bob. Um, yes, so very important to try not to skip a dose of these particular products, the bladder, the kidney, the prostate, for best results, and a minimum 3 months. It doesn't mean that if you have a more serious problem, you may need to take it for longer. Not many people have to, but at some point, usually not more than 6 months, you will get to stop taking them and not have the problem reoccur. It's not like pharmaceuticals that you're on them for life. The kidney and blood pressure formula, since we're on the topic of the urinary tract, um, herbs are not chemicals synthesized in a laboratory. They're high quality foods rich in compounds that may be missing in today's Western diet. You must remember, we're surrounded with genetically modified foods. 93% of all foods in our big chain grocery stores are or contain GMOs. It's a fact. So it's not foods that nature has provided us, it's man-made foods. And all the chemicals that surround us, it's unbelievable. Even in our city water, all the plastics, all the chemicals that are on our produce, insecticides, pesticides, fungicides, herbicides, chemical fertilizers, oftentimes chemical preservatives so that they can ship from California to Canada or from Florida to Canada. They have preservatives as well. Joan has asked a question, how much time should lapse between doses of different products? They say 20 to 30 minutes. I must admit, I have not ever followed that. I take a lot of stuff. I've been a very busy man in my career, and I don't take them all together now. I try and do it in 2 batches, but that means I can be taking 5 or 6 different things and supplements and formulas at a time. And they have worked for me. Ideally, you would leave 20 or so minutes in between, it is said. The Strauss kidney and blood pressure formula, the ingredients are juniper berry. So you'll see some of the same ingredients again. Juniper berry, uva ursi leaf, marshmallow root, golden rod, parsley leaf, ginger root, horsetail, golden seal root, nettle leaf, gravel root, and lobelia. Just to cover a few of them, juniper berry used in acute and chronic urinary tract inflammation or infection. Stimulates the flow of urine by raising the rate of glomerulus filtration, the process by which blood is purified and the water is filtered out. Our heart and kidneys both do that kind of work. After acute nephritic illness, juniper berry will return the renal epithelium to normal secreting action. Uva ursi leaf, useful for kidney and bladder infections, diabetes, and prostate disorders. Promotes excretion of fluids, strengthens the heart muscle, and fights bacteria. Soothes, strengthens, disinfects, and tones mucous membranes of the urinary passage, helps to reduce accumulation of uric acid. Marshmallow root, good for kidney problems, fluid retention, bladder infection, digestive upsets, headaches, intestinal disorders, sinusitis, and sore throat. Aids the body in expelling excess fluid and mucus. Parsley leaf, good for high blood pressure, kidney disease, bedwetting, fluid retention, gas, halitosis, indigestion, obesity, and prostate disorders. It helps kidney, bladder, liver, lung, stomach, and thyroid function. Parsley leaf is a heck of an herb, a medicinal herb. We tend to think of it mostly as garnish on the side of our dinner plate sometimes, but it's a great herb. Golden seal root again, the fabulous antibiotic herb in the herbal kingdom, and gravel root, combats prostate disorders, kidney stones, and problems related to fluid retention. Acts as a diuretic and a urinary tract tonic. So, again, very effective. To do a great cleanse of your urinary tract system, it's always good to consider the kidney formula, the bladder formula, and for our gentlemen friends, the prostate formula. The Strauss heart drops, I mean, I can't say enough about the Strauss heart drops. They saved my life.
One of the teams performing and shares how you can attend. And who do we have here in our studio? Well, the one and only Lady.
Could somebody mute their computer, please? We're getting that here. So Strauss heart drops. The ingredients. So these days, folks, I've noticed, Donald, I'll answer you in a second, but these days I've noticed they have these gel caps of aged garlic extract. Now, they're good for you. Aged garlic extract has been known for centuries to be very good for us. And it is also an ingredient in the Strauss heart drops, of course. But it isn't the Strauss heart drops. It's just aged garlic. These are bought from China for about $3 a bag. I think they're selling them for 20-something a bag. But do not be fooled that these are going to clear your arteries and do all these wonderful things that I've been reading about. So just to show you the other ingredients in the Strauss heart drops: extract of garlic bulb, and that's aged. Extract of hawthorn berry, hawthorn leaf. Both hawthorns known in Europe as a great heart healthy in their cereals and that. Cayenne pepper, bilberry leaf, motherwort, and white willow bark, European mistletoe. So just to discuss a couple of the major ones: garlic lowers blood pressure and improves circulation, aids in the treatment of heart disorders and circulatory problems, detoxifies the body and protects against infection by enhancing immune function. So aged garlic is fabulous, and Strauss has the aging process and duration down to a science. 46 years commercially available. Hawthorn dilates the coronary blood vessels, lowers cholesterol levels, and restores damaged heart muscle. Useful for anemia, cardiovascular and circulatory disorders, high cholesterol, and lowered immunity. Cayenne improves circulation, aids digestion, repairs the stomach lining, acts as a catalyst for other herbs, that's for sure. Good for the heart, kidneys, lungs, pancreas, spleen, and stomach. It's an excellent stimulant and helps lower cholesterol levels. That's just 3 of the 10 ingredients, folks. And there just is nothing like them. What a person should expect if they need the Strauss heart drops, if they have some restrictions or blockages, the first thing you should expect is your blood cholesterol level to go up. Your doctor might be shocked. That's okay. The biggest myth in the Western medicine business is the cholesterol myth. Cholesterol floating in our blood our bodies could be working perfectly. When I went on the Strauss heart drops, keep in mind I was clogged up, arteries clogged. My blood cholesterol level almost tripled. It went from what they said was the perfect 3.0 here in Canada. Then I had the heart attack. And 8 out of 10 heart attack victims have low blood cholesterol, not high. If their stuff worked, they seem to be treating the wrong people. And why do 80% of heart attacks happen to people with low blood cholesterol? Because it isn't floating in our blood. It's stuck, restricting or blocking our blood flow. Huge difference there. So my doctor was concerned when my blood cholesterol level on that first test went from 3.0, which they'd say was perfect. I was never recommended a drug previous to the heart attack. It went to 8.1 and it stayed there for about 6 months. I felt like Superman. My doctor was concerned. And then unfortunately, it was my doctor that had the heart attack. He wouldn't take the Strauss heart drops and he had to quit his practice. Wonderful man. But he just couldn't get his head around that high blood cholesterol wasn't harmful. And so many people are trying to deal with their high blood cholesterol when it could mean your body's working perfectly well. If 8 out of 10 heart attack victims have low blood cholesterol, it's pretty simple, right? If it's not floating in your blood, but rather stuck, and wherever it is, we tend to think about heart attacks and strokes, okay? Which stroke is a brain attack. Not enough blood flow carrying that all important oxygen up our carotid arteries, up our neck to our brain. Brain uses 20% of all the oxygen we take in. So if you're taking in too little, your brain is getting 20% of too little oxygen. And that cholesterol floating in your blood, it is only a problem when it is stuck somewhere, whether it's your heart arteries that can give you a heart attack, your carotid arteries that can give you a brain attack or a stroke. But make no mistake, wherever you have restricted or blocked blood flow, you will have issues. I don't care if it's your shoulders, your feet, your legs. And I'm very grateful I never had the open heart bypass surgery, because you must consider this. We have 50,000 kilometers of vessels in our body. That's twice around the earth, every one of us. When they do bypass surgery, I have two issues, big issues with that, and why I never wanted it and why I refused it. They will take a vein from somewhere else in your body, generally your leg or legs or your arms, where it belongs. The Creator put it there in the first place for blood flow. It's not like it was unimportant. They take those arteries out and use it to bypass your clogged heart arteries. So number one, we lose vessels somewhere else in our body, legs or arms, where they're intended and meant to be. And the second thing is, if you had a triple bypass, you're maybe switching out, I don't know, 12 to 18 inches of vessel from elsewhere in your body. We have 50,000 kilometers of vessels in us. The Strauss heart drops goes everywhere that we have blood flow and creates blood flow where we don't, by virtue of dissolving the restrictions and the blockages. It worked for me. It's worked for millions of people. And there hasn't been one report of that high blood cholesterol harming a soul. I sure wouldn't go on a statin drug or the so-called cholesterol drugs. How they purport to work is they don't remove one single grain of cholesterol from your body, not one, and they don't claim to. What they do is it's kind of like governing down your liver. Our liver produces cholesterol because we need it, and these statin drugs, for the most part, govern, like you can put a govern on a truck or a car engine so that it'll only go so fast. You can't go over 60 miles an hour or whatever it's set at. So these statin drugs govern down our liver to produce less cholesterol. That's how they purport to work. Jim Strauss always said that. And by the way, largest selling drugs in the world are these statin drugs. As soon as someone has any issue of heart circulation at all, that's the first thing they're generally put on is statin drugs, and usually with blood thinners. If we were meant to have watery blood, I just know the Creator would have given us watery blood. That isn't what we're meant to have. We're meant to have proper thickness blood. And because our body knows what to do with natural substances, your pharmaceuticals are not natural substances. There's nothing natural about them. These formulas are 100% natural. So if you have, let's say, we'll take the Strauss heart drops, and let's say you didn't need the, I don't know, the motherwort. Your body knows what to do with it. It usually happens in the washroom, in the bathroom. You can't overdose on apples, asparagus, rutabagas, sweet potatoes. You can get full. You could even make yourself throw up, I suppose, if you ate too much, but you can't hurt yourself. That's not the case with chemical drugs. So, to compare open heart surgery, Jim Strauss used to say that prolongs death. It doesn't prolong life. Um, and bypass just those few inches of vessel when your blood flows everywhere. And to think that the only plaque and cholesterol buildup or restrictions could be in your heart arteries and your carotid arteries going to your brain, that's just foolish. It has to be elsewhere as well. It has to be everywhere your blood flows. And diabetics can have some terrible, painful problems, legs and feet and toes, so forth, eyesight. So our body knows what to do with natural substances. You cannot overdose on a Strauss formula. One time at a lecture 25 years ago, I drank a 1 month supply of Strauss heart drops during the 2-hour lecture. And yes, I used the bathroom afterwards, but I didn't get sick. It didn't hurt me. Just like you can't hurt yourself, as I said, eating asparagus or leaf lettuce or any of those other 100% natural things. So Strauss Heart Drops, they are our flagship product. They were created for Jim Strauss by Jim and Peter Strauss after a massive heart attack in 1979. And they didn't know, it took them an afternoon with a gram scale and tasting. They always had the herbs. Jim's been a medicine man all his life. And when Pete made the tincture, they didn't know how much Jim should take. It turns out that he was drinking like a 2 to 3 week supply every day. Didn't hurt him. Without surgery or pills, in 2.5, they wanted to bypass, it was either 3 or 4 arteries. They just don't recall. In 2.5 weeks, he walked across the street to his mailbox. In 6.5 weeks, he went back to work for 25 years. Never a pill, never a surgery. He died at his 87th year, I believe. So natural is good. My grandma always taught us unnatural is not so good. So the Strauss Heart Drops, there's a reason they're our flagship product. They're just so important. The ladies' products, the Woman's Wonder for women, young women, and teens suffering during the menstrual cycle. Amazing product. It's taken only 3 days per month. If a lady is regular with her menstrual cycle, the day before it starts should be day 1 of 3 taking the formula. If a lady is not regular, then as soon as her cycle starts would be day 1, and she would take them for 3 days. Rare is the woman that needs a second bottle. It's incredible. The women's menopause formula that we have in liquid form now is also amazing. Night sweats, hot flashes, all these terrible things that just come on suddenly for our ladies. Great relief from those. Helps with the hormonal changes and so forth. Unfortunately, you do have to keep taking it. Unlike the Woman's Wonder, you do have to keep taking it, but to get rid of those nasty symptoms that are suffered is a bonus. Our menopause formula is our most complex formula. It has 20 herbs, and I'll just read them off. You'll recognize most of them probably. Blue cohosh root, black cohosh root, pennyroyal herb, squaw vine herb, raspberry leaf, cramp bark, uva ursi leaf, valerian root, lady's slipper root, ginseng root, ginger root, bayberry bark, lady's mantle herb, saffron flower, periwinkle herb, donkey root, blessed thistle, false unicorn root, sarsaparilla root, damiana leaf, licorice root, and lobelia. Now, some of those herbs do the same as some of the others, But Strauss realized we're all like snowflakes, we're all different, and he wanted to get as broad a spectrum of our female population as possible. And this is a very effective herbal formula, the Strauss menopause formula. And for our ladies during their menstrual cycle, once again, the woman's wonder formula. Now, Donald asks a question. I have a 60% blockage in my renal arteries, no blockage in my heart. I've taken the heart drops for 3 months. Do you think I can reduce blockage in my renal arteries if I continue the heart drops? First, that's the first question. The answer is yes. 3 months is certainly not long enough. And yes, everywhere you have a vein to carry blood, those Strauss heart drops are made for that, to make your blood flow full again. 2 years ago, he developed high blood pressure all of a sudden. I believe the renal artery blockage may be causing the blood pressure issues. Thinking about buying Bladder and Prostate formula. Well, that's very good, Donald. I would suggest you also take the kidney formula as well as your heart drops. Let's get that blood pressure normalized and clean out that whole system, the kidney, prostate, bladder. But do stay on the Strauss heart drops, my friend. Marianne asked, do the heart drops improve sleep apnea symptoms? Well, my best pal, he had sleep apnea very bad. He was 400 pounds, former football player. When he moved into my house, he was on 16 pharmaceuticals, hard to believe. He left my house a year and a half later at 240 pounds, no drugs, not one, and took all the most of the Strauss formulas. So his sleep apnea was helped both by change in diet, change in a bit more exercise, taking the Strauss formulas, of course, and wearing his mask at night for the sleep apnea. And it took about 5 months for Joe to no longer be suffering that sleep apnea. The Strauss heart drops, you just can't go wrong with them, Marianne, and all you folks. You can't go wrong. There are no, the only potential side effects, if you will, from any of these formulas, other than feeling better and with the heart drops, way more energy, is that you, from time to time, you can have loose bowels. From time to time, you can have more gas. It may not smell very nice either, but it's poisons, it's toxins coming out of us, better out than in. And, having loose bowels once in a while is nothing to be afraid of. And I always say to people, how long would you stay in the kitchen if you never took the trash out? You wouldn't stay there very long. So why leave it in our bodies? Doctors never talk about detoxing. I've never heard it once. And it's just very important. And if you're ever going to go on a serious weight loss program, like my friend Joe, went from 400 down to 240 pounds. But if you wanted to lose more than 20 pounds, I urge you to either at the same time or before, at the same time's good as your weight loss program, to detox your body. And these formulas, do that. You can get a good liver cleanse as well. Livers are a big filter, gets us all the chemicals from all the stuff we've done and all the stuff done to us. So otherwise, if Joe hadn't have detoxed and taken these formulas and went from 400 pounds to 240. Just follow the arithmetic, folks. They say the average person has 30 pounds of waste inside, 30 pounds. So let's just use that figure, 30 pounds. And let's use a person who's 300 pounds to start with. So 10% of their body weight is wastes and toxins, 10%. If they lost 100 pounds and went down to 200 pounds and didn't cleanse or detox, now 15% of their mass is waste and toxins. So I know we've all seen people that lost a lot of weight, didn't look good, had uneven color, red patches, uneven color. Your color should be even. And they can get sick and they can die because a larger portion of their mass, their total mass, is toxins. So if you're going to lose much weight, it's a good thing to do anyway, and it's the best weight to lose, even if you don't need to lose weight. And you ended up losing 5, 6, 7 pounds taking any of our formulas. It's the best weight to lose, folks. It's the weight that will get you in the end. So remember about the kitchen and the garbage. So we need to get rid of the waste in our bodies that will and can make us sick. I mean, cancer starts somehow in acidic environment. First cell divides unevenly, and away we go. And so many of these ailments, we can't expect to keep these poisons and toxins accumulating. I don't care if it's from smoking, drinking alcohol. Like I said, all the sprays that are on our fruit and vegetables, plastic, city water often has chlorine in it. You know what it does to your hair and your skin when you swim in a swimming pool with chlorine? Well, now some of us are drinking it and bathing in it. So we're surrounded by these chemicals. The liver and kidneys catch a lot of the heck from that, and we need to do something about it. We need to be smart and extend our lives. Not only extend our lives, but have healthy lives. Life can be pretty good if you're healthy, and life can be pretty miserable if you're not. So, I guess we're at an hour, folks. I don't want to take anybody's time, but if you have questions, please ask them now. You can unmute yourself and ask, or you can type them out in the chat section. I hope the webinar today has helped you. Feel free, if you like, to certainly join us again. The public webinars are the third Tuesday of each month at 12 noon Eastern Standard Time and 9 p.m. Eastern Standard Time. That's so all our friends out in the western half of the country get a fair chance to tune in. And we so appreciate your time. I really just want for all of you and your loved ones and friends to have what I got, which was a life back. And I'm just so grateful, and I'll remain grateful for the rest of my life that these products found me. The Strauss family found me. I'm forever in their debt, forever grateful. So, Marianne, you're welcome. Donald, same to you. So please join us again, folks. Don't hesitate. This month there's a discount on the bladder and prostate. We did that because there's so many people that have these kinds of issues, like me and my mom had, inconvenient and annoying, And so we wanted to focus on them, highlight them today, because we promise you, it's in our satisfaction guarantee, we promise you will be better. So bless all of you, and best wishes for good health. Thank you for your lovely comments. We appreciate it very much. And I really hope to see you again, or have you join us again. And I hope to, if you need anything, you have my email address. And the ladies and gentlemen out at Strauss, fabulous people. Lindy, Judy, Krista, Paula, Tammy. We just have wonderful people there, and they care about you just like I do. So stay well, stay healthy, and I hope to see you again. Take care now. We're going to end this, if I can figure out how to do that. Okay, here we go. All right, folks. You take care now. End